Here at our hospital, we are being told you need to have a plan for what your job is because half of us could get sick. Is that correct?
Yeah,
Yeah.
that is correct.
And that applies to you. It's not just the hospitals, right?
Mm-hmm.
Half of the staff at a TV station could get sick. How are you guys going to keep broadcasting and telling the important news that we need? So this is why it is critical that we get the word out that you need to take personal responsibility and control now. And I'm going to let Dr. Hawkinson take it from here. And I'm also going to step out of frame because some of you texted me last night and you were asking, are you guys going to roll on this? Are you going to videotape and that kind of thing? And so we are, so that if you guys have interest in the comments today, then we can send you that tape. The other thing I want to get with you is how can we communicate with you? What is the best way without also taxing our doctors? We want to get this message out to you, but these doctors are also going to have more increasing demands on their time. So we as a group need to come together and collectively figure it out. And I'm calling on you. And one of the reasons why I asked news directors to be on the call, and I don't know if they are, some of the news directors were routing me to their assignment desk, which I get that, that's appropriate. But we need decision makers at this call, at the desk, and I need to know, do you have buy-in? Are you interested? Can we come together as a community and have the same message? I will say that I didn't get to watch everything last night because we're burning the candle at both ends, but I think a really effective, and y'all might have had this, but 41 last night, I was watching them, and they had a patient, and that was powerful. If you can engage the community and get more patients to do the Skypes like you did, I think people saying how this sucks and how sick it makes them, I think those are powerful messages. So before I turn this over to Dana Hawkinson to go kind of through the agenda, I just need to know, do you have interest in this kind of call?
Yes, absolutely.
Yes.
And can you help us?
I mean, I think that's what we're here to do.
All right, good. All right, so I'm going to let Dana start with updating. Dr. Hawkinson, can you update what the current state of the virus is in our communities? And these are the communities we're talking about. I've got Kansas City Metro, Topeka, St. Joe, Wichita, Joplin.
Yeah, so currently for COVID-19, the current state in the community is that certainly in the KC metro area, we believe there is community spread. As far as the other, Joplin, St. Joseph, Wichita, I'm not really too certain on those areas, but I would imagine if it's not there, it is probably headed there sometime soon.
And what is the most important thing and the most important message right now? It's not, I've heard you say, it's not the number of beds, it's not the number of vents. We don't want to have to be asking that question.
So because we know there's community spread here in the KC metro area, and it's other hospitals diagnosing this, it's not just University of Kansas Health System or KDHE. That's why it is so vitally important to continue to have adherence to public health guidance. And right now, that message is self-quarantine, self-isolate, do social distancing, do not meet in large groups. And as an individual, you need health-seeking behavior, and this includes washing your hands with soap and water often, using hand sanitizer or hand gel as you can. Try to avoid touching your hands to your eyes, your nose, your mouth. Try to avoid touching other surfaces as much as possible. If you're ill and have a cough, please cover your cough with your elbow. And obviously, as we had stated just now, the self-isolation, self-quarantine part is important. Because overall, we still believe that the majority of these cases, over 80%, are probably going to be mild and are probably going to be managed from home with simple home remedies such as fever reducer like Tylenol. getting plenty of fluids and nutrition, and getting rest. A real main issue comes when we have so many infections, and so those special populations that are more at risk of severe disease and critical disease, or even other people that are not as sick but still need a level of care at the hospital, those numbers can multiply very quickly. And that is the problems that we can foresee, and we've seen in China and we've seen in Italy, is then you have a significant reduction in resources for the patients that really truly need those critical care resources.
So I want to open this up for questions. What I would ask, because we don't have a good way to do this, and we've all been on conference calls where everybody talks on top of each other, could you, when you ask a question, say your name and what station you're with, and we'll just try to manage it the best that we can.
Hi, Dr. Hawkins, and this is Taylor from Channel 41. You were on with us this morning. We appreciate that.
Yeah.
I wanted to ask you a couple of questions. One, just so I'm clear in the definition, community spread means that I can get it from someone who hasn't necessarily traveled. Like that just means it's here, right? Then I can get it from basically all kinds of places, not just someone that has traveled outside the area.
That's exactly what it means. Yes, you can get it for even if you don't travel. There can be people that have it and are spreading it either unknowingly because they are still asymptomatic, which we believe can maybe happen 1 to 2 days prior to any symptoms. Again, we are still trying to learn all of these facts. Or you can get it from somebody who knowingly is ill or thinks they're ill with maybe some other cause.
The other question I had, because I've argued with my parents actually about this in another state, is I know this is happening a lot on social media and people are seeing it a lot on social media. Can you comment at all on I can take Tylenol but not ibuprofen, that kind of thing? The anti-inflammatory has been pushed around a whole lot.
Yeah.
Is it okay for people to take certain things and not take certain over-the-counter medicines?
Yeah, that's a very good question. That was an initial post or initial article or initial tidbit of information that really, as far as this disease process goes specifically, doesn't have a lot of validity. There has not been a lot of medical literature that supports that. Now, there are issues that we know with NSAIDs or drugs such as ibuprofen, which when taken enough can certainly cause harm, such as to your kidneys. And when people are severely ill or critically ill, they certainly are at risk of other problems such as kidney failure. So right now, still Tylenol would probably be best, but as far as corroborating with that, there's not a lot of evidence to suggest that just ibuprofen itself is specifically worse than Tylenol. But we know that certainly NSAIDs and those types of drugs, which are non-steroidal anti-inflammatory drugs, can possibly cause other problems such as renal failure. It can also sometimes blunt the immune system as well.
Anyone else have a question?
I mean, I'll keep asking questions if no one else is, because I've got a couple.
I definitely have a couple whenever you're done, Taylor.
I was going to say, I was going to ask I'm the one that interviewed the patient she was talking about last night that's out of the hospital, and he was saying that he's still waiting on test results. And that's kind of what the question I asked you about this morning, but I want to get more specific because he was saying the state informed he and his wife that they are not testing every day of the week. They're testing in batches 3 days a week. I know that you're not with the state necessarily, but can you speak to that at all? Can you confirm how often they're testing these batches of tests they're getting into the state level?
And is this Missouri or is this Kansas?
This is Kansas.
Okay. Yeah, I'm not aware of their specific procedures and protocols, and I don't know their specific policies around that. I know that they are working as diligently as possible to get those results to people and test as they are able to. And that's all I can speak on. There is and obviously you know this, a national issue with testing and getting results and having even supplies for the tests. So, but as far as Kansas State specifically, yeah, I don't know their specific policy, or I'm not, I can't comment on that.
Okay.
Hi, Dr. Stephen Stites, who's the Chief Medical Officer for the hospital. He's joining us now. If someone has symptoms and don't have flu, that we should assume or act like it's COVID-19. Where do you land on that?
We just don't have enough test kits, and I don't know our test results, and we can't get them fast enough. Did you talk about that?
I just briefly gave a
Yeah, so
45 minutes. It's a second.
Oh, second thing. I was going to say, because I could go on for 35 minutes. I know Dana could too. The reality is that we're facing, boots on the ground here, is this. If it takes us 2 to 4 or 5 days to get a test result back, then what that means is we hospitalize a bunch of patients who need to be in the hospital but don't need to be in isolation. Because we have so many patients that have to be in isolation with this rule out, or people under investigation or person under investigation. I say rule out because it's so much faster, but I mean PUI. Mm-hmm. If you have that many people who have or PUI patients, then you're draining all your infectious control supplies. Your masks, your gowns, your gloves, and you put them on PAPRs, or you put them in N95 masks. You just burn through your supply, and the supply chain is so limited to get those things replenished that what you do is you can't store up the stuff you need for when the patients are no longer rule outs or under investigation. They're the real COVID-19. They're the real deal. And so at some point that pendulum's going to shift. The second problem is that so then if you test a lot of people out in the community, and this is what Johnson County ran into, when you test a lot of people out in the community, you're sending all those tests to the reference labs or to the state lab. And those guys get so far behind, which is where they are right now. They're so far behind that they can't get the answers out, so it forces all the patients in isolation in the hospitals. Our tests take just as long as everybody else's tests, that you burn through those supplies. And in addition, you overwhelm your county health departments, and so what happens is that they can't go do all the contacts because there's just too many people to go do it on. And so what they end up saying is, look, we're not going to test you if you feel like you have a cold or you can stay home, but if you come in the hospital, we'll test you. And that's, I think, what you are forced to do when you can't get test results back expediently, or you don't have enough staff to go out and try and find folks because there's just too many contacts. So then you have to shift to another mechanism. You just have to assume that you always have it. And you just have to tell everybody, you just got to stay home, right? This is what South Korea did. South Korea had enough supplies that they could run down and find everybody. But the point is the same. You just have to assume you have to stay home as if you had it. And if you try and tell all your population that, stay home and stay isolated, then you can, in effect, try to bend the curve. It's all about bending the curve so you don't overwhelm the supply of hospital beds and ventilators and things like that. So in a nutshell, that's the point where we're in. And we're here, and just remember this, right? We're at the beginning of the curve. We haven't even started having that many positive patients yet. What we have is a whole lot of rule-outs and a whole lot of people coming in contact with positive patients. The real problems are going to occur in the next 1 to 2 weeks.
Can we blunt it if we stay home? Does that really make a difference?
I think it makes all the difference. I mean, that's Korea and Japan has proven that it makes all the difference when you keep people who are sick at home, right, Dana?
Yes, absolutely.
Hey, we've got a question for you. So, like, you talk about the current trajectory of what we're on right now with supplies and the amount of people that are, that you have to bring in or just, and you're waiting for tests. So if we just stay at this level, how long will it be before the hospital systems start running out of supplies?
It all depends on the supply chain, because I don't know how much is getting made because they're trying to ramp that up. But I think there are a lot of places that have already gone to the regional, this county, the regional, and the state stockpiles. So I think KDHE can probably give you a better read on what that's like and how fast that's getting drained. But I think that's probably the big thing. So we have postponed a bunch of our elective surgeries, like a lot of them, by far the majority, and we have stopped, postponed, and closed a bunch of clinics because we're trying to not run out of supplies. And for a hospital, that's a really big deal when you start taking those kinds of actions, because you're hurting your own revenue, and not to mention you're disadvantaging patients. And so you do that at times where you feel like you have to have extreme action to make sure you can protect your workforce and take care of the wave of patients that you know is coming, right? This isn't a maybe. It is coming. It's in New York, it's in Florida now, it's in Washington State. All you have to do, and I try to read the Seattle Times on a pretty regular basis, because you can feel what's going on the ground, and then you can look at that and you can say, okay, they are 2 weeks ahead of us. This is what it's going to be like in Kansas and in Kansas City in 2 weeks. And everything you can do to try and flatten that is what you have to do. And so trying to flatten that curve is totally important. And the things we can do are the things you've heard about. You got to wash your hands, don't be in contact with sick folks, maintain 6 feet, and stay home so you don't put yourself at risk for communicating the disease. It does work. It does work to do those things. We know that. And in nations where they have taken actions that are like that, it has worked. I told our staff, we had a meeting the other day, and just before we had this big meeting, I looked at ESPN, and one of the bullets on the website was that the South Korean Basketball League was about to restart. And they weren't going to have fans, but at the end of March, they're going to restart. And you know why they could restart? Because they contained the disease and they mitigated it. They bent the curve. And that's the lesson for all of us right there. You want to go watch baseball, basketball, and football? We all want to watch that, right? Bend the curve. That's the answer.
Hey, so
really quick, hi. There seems to be like a pretty big
talking,
disconnect
please?
between. I'm sorry.
Who's talking, please?
This is Dia from 41. There just seems to be a big disconnect between the information that you guys in the medical community are sharing and what officials are telling us. I heard a governor today on one of the national morning shows saying, we're not going to tell people to stay home. We just stay away from each other. It's more of a suggestion. I know some schools are closing, some aren't. Most child care facilities, if not all, are still open. So does doing some of the measures work, or does it need to be everything at once? What does the message really need to be?
Yeah, again, the guidance from our public health officials is really, as Dr. Stites had said, stay home, okay? Meet in small groups, not large gatherings. We are in a society where we really respect human rights, and we respect freedom. And yes, it's very hard, and you can't just tell people and mandate them to stay home. You also have to allow for their own common sense or their own willingness to listen to what our officials and our public health guidance is giving us. And so there's a very fine line there, and there's people who will say, I don't care, I'm going to go to spring break, we're going to party on the beach. Until you actually have the mandates and the laws to stop them from doing that, we still value freedom here, we still value human rights and freedom of thought. We are trying to encourage, and certainly I believe media has trying to encourage people to do the right thing, seek their own healthy behaviors, seek the guidance and adhere to the guidance from public health. And that is the main goal. And all of that has been consistent, however, with, yes, we still need to self-quarantine or self-isolate if you're ill. We still need to have small gatherings. We need to have social distancing. That message has been consistent. Now, the way that it's able to get out there, certainly from state to state, that may change, but that message underlying all of those other messages is still there, and that's the important thing to note.
Now, I totally agree with Dana. I don't know which governor said that or didn't say that, and I don't know. I think, unfortunately, sometimes people don't think it's real until they've been hit in the face about it. And but I would encourage folks all around the country to go listen to Dr. Fauci, who's the head of the National Institute for Allergy and Infectious Disease. And you know, the guy's been through the AIDS crisis, the SARS crisis, the MERS crisis, and you know, he's got an awful lot of wisdom, he's got an awful lot of experience, and they're doing great, right? I mean, he knows this world, and I would listen to what he says really carefully because he's apolitical. He's just telling the truth. And then if you just step back and say, because whenever time you hear all this squabbling going on, you step back, okay, what's the big picture like? Let's see, who's doing well? Italy. They're struggling, right? They're really struggling. Japan and Korea. Okay, all three of these are democracies. Japan and Korea doing really well. I mean, not really well as they're sick, but oh my gosh, they're pushing through the crisis. And who do you want to be?
And I think you should speak to why did the governor close all their schools until the end of the year? Why is that happening
I think
now?
she absolutely did the right thing, and it's because children are often asymptomatic and bring the disease home to adults, and you won't even know. Or if they think they just have a small cold, but in adults it's much worse. And then the older you get, you know, if you give it to your mom and dad, and your mom and the mom or dad, and then mom or dad comes in contact with the grandma or grandpa of that child who is at school, and then that can be really devastating. You know, there was actually the CDC put out the initial information about critical care and about how people are doing in the United States. And there's a shift. There are a lot of young people who are getting sick and having to go into the ICU. Now, the deaths are still mostly in those who are 65 and older, but a lot of young people are getting sick with this as well. And so we all just have to beware. So I think the governor, I respect exactly what Governor Kelly did by closing schools. It's hard. I totally get it's really hard. You know, I've had 3 children of my own. I can't imagine what would happen. You know, my wife and I both work. We're both physicians. What would we have done if our kids couldn't go to school? And the answer is somebody would have had to stay home with them. But in the long run, it's a choice that we have to make. And it's a hard choice. And you just have to look at both things and say, gosh, what's the worst outcome here?
And I want to go off of that a little bit and talking about the restrictions that are in place. You know, we've got movie theaters, restaurants, bars closed, curbside pickup. Is that enough? Does more need to be done? I mean, we still have other businesses that are open. You can walk into certain retailers, grocery stores, and whatnot. Obviously, people need to, you know, take the warning to, if they're healthy, go in there. And there are, you know, senior shopping hours being established at certain retails. But do the restrictions that we have in place in the Kansas City metro, are those enough, or do we need to go further?
You want to take the first shot?
I'll take the first shot at that. You know, again, this goes back to my other point of we still have human freedom and human rights. This is a very different time than it was when the Chiefs won the Super Bowl. And that was not long ago. And we have to understand that we are trying to do the best we can, trying to continue to send the message to social distancing. But we do still need to live our life. And we still need to go to the grocery store. And we don't need to hoard toilet paper and eggs. You know, there are people who are out there buying toilet paper and eggs just because they're fearing that they're going to run out. They're not scared about the virus. So there is also just a lot of anxiety around this in general. I think that continuing to adhere to the message as much as possible, but you still need to live your life. You need to get groceries. You need to live a healthy life with nutrition. You know, you obviously need toilet paper. But there's a lot of details in all of that. But the message is still there, you know, even though we continue to need food and products. We can avoid these other large issues such as mass meeting places like restaurants, like bars, like NBA games and NCAA games as a way to try to mitigate the spread of this disease, and also going at certain times to try and mitigate the spread of this disease. And when you're in the shopping, I guess not shopping centers, but the stores, you know, you're not, hopefully it's not that busy, you're not bumping up against people, it's not like the subway, so you're still maintaining some social distancing there. And so all those things combined still go with the same message of overall social distancing, not having mass gatherings. And during all this, you can continue to have hand hygiene and use alcohol gels when you're in the stores. But all of that doesn't detract from the the main message, the main underlying message.
I have to laugh about the Chiefs in the Super Bowl. It's true. I saw that joke. We're going to give coronavirus a double-digit lead and then call Patrick Mahomes. If only it were that simple, right? If only it were that simple. And we all are giving up stuff. I work out pretty regularly. Dana does, I know. I'm in this workout group, and we can't go do that anymore. So some of the guys are trying to get together on Saturday morning, stand 10 feet apart at Loose Park, and
outside.
say, go outside and do it. You bet. And it's supposed to be 34 degrees and windy, so I don't even think there'll be many people there anyway. So, these are hard choices.
Yep.
In America, it's, right, to Dana's point, there's freedom. You have to make choices. But sometimes the choices are hard, and sometimes we have to really encourage people to make the right choices. What did they do in New Rochelle when the virus took a hold in a community? They shut it down. We just, if you want to get out and go to the Royals and the Chiefs and keep people healthy, the answer has to be, we don't have many levers to pull. We don't have a vaccine. We don't have a drug. We have to shut it down. We know what works. Shut it down. We saw what Korea and Japan did. Shut it down. We saw what Italy didn't do. Who do you want to be? That's the question. We still have a choice. Who do you want to be?
Do you think there is potential that eventually if this doesn't calm down or, flatten the curve, that we could have no NFL season, that we won't be able to go to those Chiefs and Royals games you're mentioning?
Oh, it's totally possible if we don't shut it down. You're right. If it's still going like this next October, you think there's going to be NFL? No. Another year we waste waiting for the Chiefs, because you know what, they're going to win the Super Bowl again next year.
That's right.
Hey,
they got to play.
Chance Swaim here with the Wichita Eagle. I had a question, sort of in that same line of thinking. Just how long should people expect to kind of be living this way, and with social distancing and all of that?
I don't have a good answer. This is Dana Hawkins. I don't have a good answer for that for right now. As long as it takes is the first answer. The second answer is that I know that there have been dates from when the quarantine from different periods and different places are put in place. I'm pessimistic that it'll be before those dates and on those dates. I suspect as we're moving and we see continued community spread and more communities who are involved and affected by this, I suspect it'll be longer. There's no crystal ball, though, to prognosticate how much longer. That is a day-by-day thing. That is looking at the data, looking at the cases, and reevaluating and kind of making the decision based on those types of things.
I think it totally depends on what our response is. If it's an inadequate response, it's going to go on for a very long time. And if you have a really good response, you can help shut it down. And then we think we're 12 to 18 months away from a vaccine. So there's long-range hope, and there'll be other drugs that are discovered. The difference between what happened in the AIDS epidemic and this pandemic is that we didn't have the ability to do the things we do today in terms of research and drug production and how rapidly we can respond to this. And I think that that's the good news. We can respond pretty rapidly, but the thing that we can do in the meantime is, we keep saying, shut it down, right? That's pretty simple. And so how long will this go on? Totally depends on what our response is.
Thank you.
This is Dia from 41. Do you think that we're doing a bit of a disservice by reporting maybe the numbers instead of how wide and how quickly this can actually spread?
I think the answer is we got to report all of it. I think the numbers help just to gauge it. But I look at the Hawkins coronavirus map 4 or 5 times a day. I bet Dana does. There's all these other websites that are out there, and so you just watch it spreading, and you can see it, right? You can watch the map blow up on both coasts and come toward the center of the country. So it's all coming to us. It's just how are we going to respond? That's the test. How are we going to respond?
And I was going to say, and maybe putting those numbers out there. The people that still don't understand that this is truly a significant issue, maybe at some point the number threshold in their brain will click, and they will. And some people just need more encouragement than others.
Joe here with Channel 5. You mentioned that Laura Kelly made the right call in doing this. What needs to happen on the Missouri side? Are we making the wrong call here if we're doing the opposite?
I don't know that we're a couple of docs here trying to work in the front lines at KU and taking care of folks. I don't know if it's our job to make that comment, but my comment is just the more you do now, the less you will pay the price later.
And then one more question, totally respect that, I understand it. One more question that I'm getting inundated with from viewers is they aren't really understanding, and I know it's a new virus and we don't know, but can you provide any insight as to when you get diagnosed, if you test positive, how long of an immunity have you built up, or can you get sick again after that?
Yeah, that's a great question, and a great question that is fielded all the time and by me and asked all the time by other people. The answer is we don't know. Again, this is SARS-CoV-2, so this is somewhat of a cousin to SARS. It has homology with SARS. It is similar to SARS. It's not exactly the same, obviously. And we know that certainly long-term immunity, meaning probably 1 year, probably 2 years, you really start to see a decrease in your antibodies. And antibodies is what your body makes when it comes into contact with things such as viruses. We know there's a significant decline after 2 years in those antibodies. So how long is immunity? Well, we hope it's 3 to 6 months. And can you get infected? Hopefully not within that time period, because you have just, essentially, your body has just seen the virus, and so you still have an immunity built up. But as far as fully, can you get infected again? We just don't know the answer to that question. We would hope not, because you have just recovered from the infection, hopefully. But as we see 2 years down the road, especially with the original SARS virus, your amount of antibody in your body does start to wane. Now again, even that, we don't know if that means you have a decreased immune function to that as well. So there are still a lot of questions that we can't answer for that.
Got it. Thank you.
This is the at 41. I swear this is my last question. Would you mind just kind of explaining for people the difference between like linear growth and exponential growth? Like how quickly the number of cases, and I apologize, my son's in the background here. Would you explain, I mean, the number of these cases can multiply very quickly, and what that's going to look like for people like you?
Yeah, so I'll try that, and Dana will correct my math. So let's assume it's more of a linear growth, and just as an example, I have the disease, I give it to you. You have the disease, you give it to one other person. And that person has the disease, they give it to one other person. That's more linear growth, right? It's just kind of percolating along. Unfortunately, that's not how coronavirus, whether it's the common cold virus or COVID-19, is going to work. I have the disease, and I can give it to a multitude of people, because I can sneeze, and 5 other people can sit down at that table and all put their hand in it and wipe their face, and all of a sudden I just gave it to 5 people. And then those 5 people give it, they do the same thing. Man, they're each going to give it to 5 people, and 5 people just became 25 people. And the next time, that's 125 people. And it just keeps growing and growing. That's exponential growth. And that's how a virus like this can spread. And so it can, that's why, Kansas has whatever it has this morning. I don't know if it's, I didn't see them have it. It's like 20 or 20 people, whatever. But the problem is that there's a lot of other people that aren't diagnosed, or those little children that would have been in school, Kansas, Missouri, doesn't matter. And they give it to a bunch of people because mom and dad handle them, and then boom, they give it to a bunch of people, and all of a sudden it's this exponential growth. That's why staying home makes all the difference, because I give it to 1 or 2 people, but they don't go out and give it to a bunch of people, and then it runs the course, and then it's done. And that's the difference between logarithmic or exponential growth and linear growth, and that's why containment and that's why isolation and self-quarantine, that's why it works.
Wasn't there some research that showed that the difference a day could make?
Yeah, it's huge.
Thousands.
It's crazy. Yeah,
thousands.
Thousands of people, because again, it's all about where are you on that curve, and again, it's a exponential or logarithmic curve.
And I would like to absolutely echo what Dr. Stites said. We understand that one person may give it to 1 or 2 people, but we also understand from previous outbreaks with Ebola with MERS, with SARS, that there can be super spreading events. And these are well documented. And it's not everybody giving to a lot of people, but it's 3 or 4 or 5 cases who then spread it to 25, 50, 60 patients. And then that is cause for exponential spread as well. And so we really want to keep people home so they're not coming into contact. And you never know who is that super spreader, or what is the super spread event. But those do happen, and they are well published articles and from previous outbreaks, and that is the other thing that we are trying to prevent as well by social distancing, by self-isolation.
I think you just coined a new term, the super spreader.
I did.
Yeah, I heard
that was
that.
from.
That's good.
So we're probably going to wrap this session up here pretty shortly. I want to ask everybody that's on the line, do you have another question?
I have one more. This is Chance with the Eagle.
Go ahead.
Yeah, about the super spreaders and back to schools, is that kind of the reasoning behind why it's a good idea to shut down schools? Because kids could be super spreaders. They seem to all be, kind of all over each other all the time. And is that kind of the reasoning behind that?
Well, again, I think that super spreading events, again, they are published in peer-reviewed articles. We've known about that. That's not new. But the problem is you just don't know who that will be. So could it be a child who may be asymptomatic for 3, 4, 5 days before getting a slight illness, and in that time when they're asymptomatic, they are spreading it to people? Is it an adult who's walking around who has contact with a lot of people, or is that the Big 12 tournament who may not know that they're ill? So we don't exactly know who that is, and there's no way to really readily identify those events or those persons in particular. But that is, as Dr. Stites alluded to, that is the main reason why we are trying to shut things down, trying to prevent that from happening, trying to prevent exponential growth and change the trajectory of the curve.
And I think what happens in general, and you comment on this, Dana, but the child who goes to school probably isn't going to be the super spreader. The child who goes to school and gets somebody who's infected at home, and then that guy or gal goes out to the bar and hangs out for a while, and then 20 people in the bar, and all of a sudden, boom, there it goes. And that's the risk.
Or they're jumping on a plane.
Jumping on a plane, exactly. Or those are the risks we face. And again, as I said, we want freedom. Okay, well, this is freedom. You have a choice. What choice do you want to make?
You're all doing fantastic work. What can they do, news directors and these reporters, to protect themselves?
It's all about social distancing and trying to make sure you get enough sleep, because we need you. We need you guys to deliver the message to people, to get them. They do listen to the things you all put out there, and so the way that you can help yourself is to make sure you get a lot of sleep, make sure you eat right, exercise, do your social distancing, and wash your hands for 20 seconds.
Yeah.
I mean, there's no magic pill.
That's
It's
right.
the basics that do the most.
Appreciate you more
Hey,
than you know.
hey, Jill.
Yes.
Can I ask one more question before they leave, and then that's it? I promise.
Yeah, you got them before they got their mics off. So
Okay. I came in a little late, so if you answered this already, just let me know. We were recording it, but we keep telling people time and time again that don't panic. This affects the elderly the most, and I know that they're most at risk of dying. But does our message or our delivery need to change at all as we start to see that younger people are getting this? Should we be phrasing things in a different way now?
No, I think our message is consistent. As you stated, patients over 50, but especially over 70, and those patients with comorbidities such as heart disease, lung disease, diabetes, are most at risk of potential for hospitalization and critical illness and mortality. We obviously know that young people get sick, but the majority of the mortality, the majority of the deaths, are those older special populations. But as you get to have more and more infections, obviously all ages are going to be affected with that. And so you're going to have just higher numbers of even young people who are ill. So I think the message has been consistent, We know that young people do get infected and do have worse outcomes as well, but certainly not in the proportionality of those special populations I mentioned. And as we are still in the midst of this and in the very beginning, we are still trying to compile data for our country while also looking at data from Italy, South Korea, Japan, China, and other countries that have been affected with this as well. So our message continues to be consistent, but we may be seeing a shift, and we just may be seeing more young people infected for various reasons, more young people seeking hospitalization for various reasons. But we know that happened, and as we get to have more and more infections, those numbers will grow proportionally because there's just more infections, and so there's more people to possibly seek hospitalization and critical care services.